Hello, my name is Jeanine Roman. I'm in the Family Nurse Practitioner Track program. I'm currently in 664, and this is my pocket guide. I decided to organize it in a 3-ring binder and use sheet protectors. This is my table of contents. So my first section, I started with the HEENT. I started off by having a column of common questions to ask. For example, for head, any headaches, eyes, any changes or problem in your vision, ears, any problems in your changes in your hearing, or for nose, any frequent colds or trouble breathing. Trouble smelling. So then I go into the different categories. For example, like eyes, I include different diseases, the pathogen, treatment, common presentations for each disease. Same thing for ears. Then when to refer, and then red is like the emergency or like urgent. Same thing for nose, presentations, complications, risk factor treatments for the different diseases. Same thing for throat. Then I go into pulmonary diseases. Some that I included, for example, are asthma, COPD, pneumonia, obstructive sleep apnea, PE, and with those I included sign and symptoms, diagnosis, treatment, diagnostic testings. And then I have my cardiac section. So for cardiac, I included blood pressure, hypertension, how to monitor blood pressure, high, lows, what type of medication to start the patient on, the different labs that you look at, different diseases, the different antihypertension medications. And then for the medications, I included like the route, the adverse reaction, the contradictions, side effects, education. Just continues of the medications. And then I also included diagnostic testing, for example, like AKGs, blood work, like LDL, cholesterol, triglycerides, the lipid profile, all that. And then I go into the family planning pocket guide section. For example, I included burial methods, hormone methods, when they do get pregnant, I included like different things to look like in the trimesters. Different labs in each trimesters. So for example, like TSH, free T4, chlamydia, gonorrhea, all that, hepatitis, lead. And then I go into the GI. So for GI, I talk about the different diseases. Again, the cause, the signs and symptoms, the treatment, the diagnostic. I talk about peptic ulcer disease, diverticulitis, appendicitis, bowel perfusion, abdomen trauma, the different sign and symptoms. For example, the gray Turner sign is the bruising on the pharynx, the Murphy sign for appendicitis, all that. And then I go into thyroid. I included like a diagram of the thyroid hormone production. And then I talk about the hyper, and then I talk about the low, which I include the labs, the causes, the sign and symptom priority, the diet, the treatments, the medications, what to avoid, triggers, emergency conditions. And then I talk about the thrombolytic events like DVT, the treatment goal, patient education. And then I go into diabetes. So for diabetes, I included type 1, type 2, sign and symptoms, the cause, the treatment, diagnostics. And then I have like a little mini pocket guide of itself, how insulin works, gestational diabetes, and all that good stuff. It's like a little mini packet that I included in there. And then I'm going to pediatric. I talk about febrile infant, like what to look for, the septic work of blood culture, jaundice, the treatment, sign and symptoms, medications. So my preceptor was telling me like a good tip. So I included this additionally, is she was telling me that I should have the most common medications. So I included like the most top 50 common medications, for example, like she told me like the diabetes medications like metamorphin, insulin, the hypertensions like the LOL, the PRINs, the steroids like prednisone, antibiotics like penicillin, amoxicillin. And then I just included like a little picture of like each category. And then I included like the AFib, the dosing, and then of warfarin and Coumadin. And this concludes my pocket guide. Hope you enjoy. Thank you for your time.